All right, welcome everybody. Maureen Smyth, BSN, is an RN graduated from Simmons College in Boston, Massachusetts, with a Bachelor of Science in Nursing. And Maureen went on to care for spinal cord injured war veterans. She also worked on a world-renowned liver and kidney transplant unit in San Francisco. And Mo has worked in very fast-paced inner-city hospitals as well as small rural hospitals throughout Northern California. Her current passion for education about the role of cannabis as a healing herb comes from her belief that the current paradigm of American medicine is broken, and cannabis medicine will bring the positive change needed to create the get rid of the overdependence on big pharma. We welcome Maureen Smyth to the Mendocino Cannabis Alliance and visit Mendocino County's Health and Wellness Symposium, and we welcome her to Dragonfly Wellness Center on the Mendocino coast. Thank you very much, Mo, for joining us. And I'll turn it over to you.
Thank you. Wow, yeah, that's true. I did do all that, and as I was about 2/3 through my RN career, I started noticing, why aren't people getting better? Like, we have all these medicines, we're the best medical system in the world. Like, why aren't my patients getting better? In fact, why are they getting sicker the longer I stay in as a nurse? So this is how this talk evolved. It's going to provide a deeper understanding of how cannabinoids work to provide pain relief. And I hope to offer you also some practical how-tos. So we're going to go over what is pain, and that does get a little scientific, but I tried to keep it at a level that we can understand, because we're all trying to understand our pain, right? If we home in on it, if we understand some root underlying causes, we may be able to chip away at it. And how does cannabis help us do that? Well, it is one of the world's most natural anti-inflammatories, and NSAIDs don't work well for long-term use. Like I said, we're going to go over some ratios and dosing. So if you're in pain, don't worry, you are not alone. Millions of American adults have chronic pain, the kind of pain that interferes with work, self-care, and quality of life. So the first line treatment options for chronic pain in America are pharmaceuticals and surgery. Unfortunately, with age comes pain. Older Americans report higher rates of pain. Chinese texts indicate low THC cannabis was being used as a pain medicine approximately 3,000 years before Christ. Fast forward now 4,000 years, where pain is the #1 reason why people seek out cannabis, and one of the best supported medicinal uses of cannabis is for the treatment of chronic pain. So at first, pain is good. It's an early warning system of specialized receptors that detect when we are in pain, and then send out signals to the brain. Pain signals are alerts, and they're signaling the brain to do something, and do it quickly. Seek safety, protect yourself. So, pain is good. This is the type of pain we feel when touching something too hot, too cold, or too sharp. The beauty of pain is that it's protective. Pain is still providing protection after an acute injury with pain hypersensitivity. Hypersensitivity is a signal to the brain to lay low. Hypersensitivity discourages activity and contact that would cause more pain. So it's your body telling you to stay out of the way, rest and resolve, I'll resolve this. And that picture on, am I circling it? This guy is a picture of the central nervous system and it was, in an autopsy, they got the central nervous system out in an autopsy.
Whoa!
In 1837.
Wow.
That's where I got that picture. I don't know how. Isn't that crazy? I wish I could make it bigger, but it's pretty wild. So these are the guys that are causing trouble here.
Those are trees.
Yeah. So these are the ones that are telling your brain everything.
Well, before you leave that, can I ask a question?
Sure.
So, do you think that this is pretty accurate in terms of the nerve endings coming from the spine and going down the legs? And because there's a whole in the thoracic area of the spine, I'm not seeing nerves coming out.
Yeah, maybe because it was from the 1837.
Yeah, right. Well, that's probably the right answer.
But I was still very impressed.
Yes, I am too.
So we have pain receptors, right? They're specialized cells. They're located in our joints, in our muscles, in our GI tract, in our internal organs, as well as our skin cells, which is important when you think about why cannabis topicals work, because we have certain receptors for these specialized pain cells, and they're right on our skin. So for me, if I am helping somebody in pain, I think that they should always have a topical on board, a cannabis topical, in addition to their other modalities. So because cannabis molecules directly target these actual pain receptors. So this is important because these pain receptors respond to blunt force trauma, crush injury, cuts, and penetrating wounds. And so as soon as something like that happens, we have cannabinoids that kind of rush in and try to fix everything because they have a special receptor that has an affinity for our own internal cannabinoids. So we'll get into that a little bit later. So these pain receptors also transmit signals when we come into something that's a chemical or something that's too hot or too cold. So pain is relieved when pain signals stop firing. That's the magic. That's what we're all trying. That's where the magic is, and that's what we're all trying to do is to stop those pain signals from firing. Chronic pain is not protective. Remember, the first two kinds of pain were protective. Chronic pain is not protective. It's abnormal. It's an abnormal functioning of the nervous system. So in chronic pain, signaling has gone rogue. Pain signals are amplified and hypervigilant, even when there's no underlying cause for these hypervigilant and amplified pain signals. That's what's going on with chronic pain. These are false alarms, like that boy who cried wolf when there weren't any in the vicinity. That's what chronic pain is. It just cries and cries and cries. I'm in pain, do something. Even long after the injury is healed. Neuropathy is one kind of chronic pain. Neuropathy pain signals are sent after the initial insult, if there ever was one, has healed, right? So the healing's gone, long gone, but the pain lingers. Some conditions like fibromyalgia, irritable bowel syndrome, tension headache, TMJ cause a lot of pain but have no precursor injury or inflammation. Central pain is a type, neuropathy is a type of central pain. It's any pain that happens when the central nervous system doesn't process the pain signals properly, and it even creates this syndrome where those pain receptors grow closer to each other to better send a continuous pain signal. So when we are in chronic pain, our body is remodeling to receive chronic pain. Long outliving its protective nature, chronic pain is a mental and physical burden, and it severely impacts quality of life.
Yes.
So here's something you may not know. Cannabis molecules target those same pain receptors that pharmaceutical companies spend billions to research and develop. And cannabis activates many of these targets simultaneously. That's why cannabis offers superior relief. Sometimes with just one puff, one gummy, one transdermal patch, one bath bomb, or one topical application. And remember, the way topicals work is by getting to those pain cells that are directly on our skin, and it kind of keeps them from being overactive. Cannabis dampens, essentially lowers the volume on pain signals being sent up and down the spinal cord. Cannabis blocks chemical substances produced by the body that excite pain receptors. Meditation does this too. Cannabis also reduces inflammation in our brain, and at different other cannabinoid receptors, cannabinoid signal changes how much the pain is perceived and how a person reacts to their pain. I do talk about that a little bit more. So through other receptors, cannabis has access to our immune cells. So, I mean, it's once you grasp how wide-reaching the cannabinoid system are, you can understand, there are cannabinoid receptors on every single type of our immune cells. The B cells, the T cells, the mast cells, every type of cell that have in our immune system has the possibility to be modulated by cannabinoids. So anyway, so that's a good alternative for treating wounds and reducing inflammation. So inflammation is an immune response. It's vital. It's helps us protect infection. It helps us fight infection and heals both internal and cell injuries. At first, inflammation is good too. It supports our survival, but long-term systemic inflammation is bad. Oops, let me go on the right slide here. Okay, so you can, I don't know if you can see that, but chronic inflammation is at the root of cancer, arthritis, Alzheimer's, neurological diseases, cardiovascular disease, autoimmune diseases, pulmonary diseases, and diabetes type 2. All the root cause is inflammation. But cannabis is kind of known as like one of the world's best anti-inflammatories. Cannabis has a lot of receptors that it uses to contain an overactive inflammatory response. Cannabis also helps with this kind of systemic inflammation at the root cause of a lot of American diseases and mood disturbances as well. So you can kind of see why cannabis is like all-reaching, or at least starting to get a picture. This is a brand new headline, common arthritis treatment may actually accelerate disease progression, and they're talking about corticosteroid injections. So.
How does that accelerate it?
Yeah, I didn't really get it. That would be a whole nother lecture.
Okay.
Yeah, systemic, I should have put the, I did, it's from SciTech Today. Or SciTech Daily.
Yeah.
So Harvard Health, systemic inflammation at the bottom of a lot of American diseases, mood disturbances, but a lot of Americans take anti-inflammatories and NSAIDs. But these meds have side effects that include GI bleeding, heart attack, and stroke with long-term use. With full-term legalization in this article from Harvard Health, they anticipate medical cannabis will be recommended for those who cannot use ibuprofen, naproxen, or Tylenol, which also has serious side effects. But I think if Harvard Health has the research to make this type of endorsement, that they really should push for federal legalization now. So, bottom line, cannabis is a safe anti-inflammatory. If you were to vaporize a whole flower cannabis, you'd potentially be consuming a couple dozen anti-inflammatory molecules at once, says Dr. Adi Ray. She's a neuroscientist who studies cannabis, opioids, and their interactions. Dr. Ray continues, in this sense, whole plant cannabis is like a multivitamin for inflammation. So according to Dr. Bonnie Goldstein, her patients report cannabis reduces pain and inflammation, improves mood, and promotes sleep. A lot of times these patients often have overlapping conditions. Cannabinoids are known to help, like chronic fatigue, irritable bowel, chronic pelvic pain, daily headaches, anxiety, depression, disturbed sleep. Yet many are better, happier, and more functional once they accept cannabis is a medicine that works for others who have similar health problems to their own. The following dosing methods are from patients with musculoskeletal joint pain. Some have central pain syndrome, which actually, like I said, rewires that brain to make the body experience continuous pain. These patients often have symptoms besides pain, like fatigue, brain fog, moodiness, and problems with sleep and digestion. So here's some of, this is just showing you the range of dosing and products and things you could try using cannabis. It really is somewhat infinite. It's you know, it's good and it's also, you know, that's what makes it very difficult. So here, one of her patients takes 50 milligrams of CBD in the morning and afternoon, and likely people who take CBD that way find that it keeps them awake at night, so they have to stop in the afternoon. But there was another patient who's taking only CBD, 100 milligrams just at night, and it has helped her with pain and sleep. So that's sort of an idiosyncrasy of the of cannabis and the endocannabinoid system. It's all very different. It is true that some people CBD will make them, you know, alert and not sleepy, whereas some people find that it does help them to sleep. So so you just have to know which one are you. So another patient, well, she does, you know, with fibromyalgia, is just taking a 5 milligram THC gummy at night. That's like, she's one and done. She's good, you know. So here's something, a dosing regimen that layers a lot of different cannabinoids and different methods of ingestion, because very few people are those one and done people where they just get to take a 5 milligram gummy. They're out there, but they're like unicorns. So this patient takes a tincture that contains CBD, THC, CBDA, and THCA twice a day, and then it has like how much of each. She's at 5 milligrams of CBD and the acidic cannabinoids, and then only 1 milligram of THC. So that's very unlikely to cause any sort of intoxication at that ratio. So she is also using a topical 1-to-1. That's this same amount of CBD to THC ratio, and she's using that in a topical onto painful areas as needed. And then in case she has trouble sleeping, she dry vapes THC.
I've never heard of that, huh? Vaporizer.
Yeah, the vaporizer is an alternative to smoking. They're little handheld devices, and you just put a small nug of cannabis in it, set the temperature, and then there's no combustion involved. It's vaporization.
Oh.
Yeah.
Because I can't smoke. I've tried and tried. I've never smoked in my life.
Yeah.
I can't even get this to work for me
Yeah.
without coughing half to death.
Yeah. It's possible, a dry vaporizer, a little.
I'll check that out.
Yeah.
Okay.
I can send you some recommendations for
Okay.
some that my friends would like.
Huh.
So then again, here's another low dose 2.5 mint in the morning. So these are these sort of kiva mints or petra mints. I don't know if you've ever tried them. Those are very, you know, discreet, simple to dose. I think it's a 5 milligram mint, and then you could cut it in half and get a 2.5 dose. It's all THC, so it has no like CBD in it, but again, it's a very low, consistent dose. And then this person is using smokable THC before she goes to bed. So that's that. There's a lot of different cannabinoids, and there's a lot of things you can do with them. I added this slide. This woman's she was doing 4-to-1 ratio. I'm not sure if it was THC to CBD or CBD to THC. But then she had to add CBG, and that's what's happening is the more, you know, we have some, you know, now the research is unbelievable. Like the studies are just, you know, flying. It's legal to study cannabis now, so we are researching cannabis as of 2022. We can research the positive effects of cannabis in the body. You know what I mean? Anyway, so CBG have been like kind of a little bit of a darling. You know, there's lots of trends in the cannabis industry, and CBG trended very large for a while. And then what happened was this doctor, Dr. Russo, did some research on it. I'm just going to go all into the endocannabinoid system, but let me just go to CBG because do you think, Jude, that this is like, should I keep going? Because it's longer than this.
Whatever you have the tolerance for, I mean, we're recording this, and if you think this is, the material is beneficial to the people who will be tuning in to watch your presentation, it's all up to you, Mom.
Okay. Well, let me just go to CBG real quick and then I'll go back.
Sure.
So CBD has shown excellent potential in the treatment of pain and inflammation. Dr. Russo has carried out a human trial that indicates CBG works well for inflammatory bowel disease. So these are human trials that are showing that CBG is working pretty well for a couple of things. CBG has neuroprotective effects against Huntington's disease.
Yeah.
You know, which is like a really horrible, incurable disease. So it's pretty amazing. And then, and because they have that neuroprotective aspect to it, these CBG molecules have been shown potential to improve self-regulation and executive function in ADHD disorders. So the bioactivity of CBG at many body receptors has a lot of therapeutic potential. And, you know, the bioactivity of cannabinoids at these receptors, they can't be underplayed. You kind of have to tell your doctor. You know, you have to tell your healthcare provider. And the more we tell our healthcare providers, the more they start to understand that their patients are using cannabis, their patients know a lot about cannabis, and they themselves should get on board and learn about cannabis too. So I think it's, I think this is why the VA is doing so well, because veterans are not shy about their cannabis use anymore. It's on their medical records, and so we really need to push this ball further along. So even if we've never gotten so much as a whiff of cannabis, our bodies naturally make cannabinoids. So this is happening in the absence of any sort of cannabis. Cannabis activates a lot of different receptors. So when adding cannabinoids to existing medical treatments, like I said, unfortunately, you have to tell your healthcare providers, because we've got interactions at these family of receptors, these family of receptors, these family of receptors, and this is not even the gist of how many receptors cannabinoids activate throughout the entire body. You can think of receptors as being like entry door keypads on a cell membrane. So this would be like, the cannabinoid trying to get through, and this would be the receptor deciding if it's going to let it through or not. But cannabinoids happen to have the master regulatory code to get through almost all of our cells and almost in every organ. By accessing cells and modulating cellular behavior, cannabis sends signals forward throughout the body or stops those signals from being propagated if that's what's necessary. So it's a modulatory molecule. It'll let things through, but it'll block other things. That's just a very simplistic definition of that whole thing. Because we make cannabinoids, we have a built-in system that can potentially work better if you supplement it with phytocannabinoids. It's not a foreign object or a foreign molecule, like the body recognizes it. Sometimes our endocannabinoids need help from their molecular relatives, which is THC. So now you can see the cannabinoids are doing what they want to do, right? But you can support the cannabinoid and the endocannabinoid system if you add a little THC. All you're doing is you're helping the molecules that are already trying to heal our body, the endocannabinoids. So once you understand how vast this endocannabinoid system is, it's easier to understand how cannabis works to ease the pain and the entourage that often accompanies pain, which is insomnia, anxiety, and depression. So cannabis helps with sleep related to pain. We have some pretty good human data from the UK on Sativax to back up this claim. Data shows that sleep parameters are better in people who have multiple sclerosis, peripheral neuropathy, cancer, and arthritis when they use Sativax. Sativax is a one-to-one cannabis medicine available in the UK. So that's where you're getting the same amount of THC to the same amount of CBD, and which ratio that is based on you trying and you knowing your body. 40 to 50% of the study participants report good or very good sleep even 4 years later. So most studies I read often have this overly positive bias towards CBD as being medicinal, with an inflated negative bias about THC as not being medicinal. But as you can see, THC is a very medicinal molecule. It's anti-cancer, anti-inflammatory, antioxidant. I don't have to read it to you, but I mean, this molecule is busy and, look, happy. Helps with itching,
That's nice.
opens your airways. As we know, it stimulates the appetite, anyone who's gotten munchies.
Oh, yes.
Here we are talking about chronic pain. If you ever get diarrhea, take a puff, it'll be gone.
Oh.
And cannabis is a well-known muscle relaxant and antispasmodic.
No.
THC is medicinal, CBD is medicinal. Combined, they're even more medicinal. Combining CBD and THC is good because they have different mechanisms of action in the body. Both work on similar problems to provide less inflammation, depression, and anxiety. And they also both work to give you more muscle relaxation, pain relief, and sleep, sometimes, based on how you react to each one, because I know many people, THC just keeps them up all night. So, some notable differences between the two primary cannabinoids. THC can be impairing, CBD is non-impairing. THC can modestly reduce blood pressure and eye pressure, but CBD can modestly increase both. Alright, so that's something you should know about CBD. THC can stimulate the appetite, and it's pretty well known that CBD reduces the appetite. So is that one-to-one the golden ratio for primary cannabinoids? Well, maybe, maybe not. According to Dr. Russo, neuropathic pain responds well to a one-to-one. Dr. Russo has been studying cannabis medicine for 40 years. He had to go outside the country to study it, but he's done a senior research on the first American plant cannabis pharmaceutical product that is approved by the FDA. So we do have one product, cannabis product, that is pharmaceutical. So Dr. Russo thinks a one-to-one works well because THC chips away at the pain, CBD is managing the inflammation. CBD is a pretty effective anti-inflammatory. With a one-to-one, extensive research shows that a one-to-one often produces superior therapeutic effects for another reason as well. Because you can, with these appropriate ratios, you can bypass the undesirable effects of THC. All right, so you can just sort of skip over, jump the shark, and bypass THC undesirable effects if those bother you, like, you know, intoxication, giddiness, sedation, increased appetite, rapid heart rate, but you're still going to get the medicinal effects of THC. So that's one of the reasons why they work so well together. I know I'm helping the stereotype here, but the thing about it is that there's a lot of people who are super sensitive to THC. So like a 2 to 1 to 5 to 1 CBD forward ratio will produce lower risk of mind alteration. Most likely because the increased alertness and clear thinking CBD provides will be the more dominant effect because you're front loading the CBD versus the THC. And so that's what's gonna give you the most dominant effect. So that will possibly override the THC, like jitters or sedation or euphoria. So they're good partners and they work synergistically. They boost each other up. So here's another dosing regimen if you want to try CBD, if you want to try to add both cannabinoids to your life. Like a lot of people I know are kind of team THC and then others are team CBD. But really the magic of these molecules is, when they're all together. So if you wanted to try this, you start with 4 milligrams CBD tincture and 1 milligram of THC, and then you increase by 4 milligrams of CBD and 1 milligram of THC every 3 days. Okay, so you're gonna, after 3 days, you increase, and you do that until you achieve satisfactory results or unwanted side effects. If you have unwanted side effects, you just pull back and you decrease your dose. Like pull it back from, where 1 milligram of CBD, I guess you're down to half that THC. So do you get it? Like, do you get that? So dosing, okay. So you decrease, and the max dose for this little recommendation from Dr. Sulak would be 40 milligrams CBD and 10 milligrams THC. So
That's really high, excuse me.
that's high, that's high, but
very
some
much
people,
low.
but that's like, that's a typical dosing range, 4 milligrams.
Really?
Some people might need just 4 milligrams of,
So 4 or 40?
yeah, but some people might need both. That's why cannabis has a big, safe range.
I wouldn't even be able to walk across my floor.
But if you needed to, if you had a serious diagnosis, you could increase your THC to where the negative side effects are being, they kind of drop away. If you had to, yeah.
Whoa.
If you had to get up to 40 milligrams CBD, 10 milligrams THC, it's doable. You just titrate
I'm
up
lightweight
slowly.
too, and I do 2.5 milligrams, and that's, I'm a real lightweight. You just adjust your dosing.
Yeah, me too. How much for a 200-pound male?
It's really not weight-based at all.
No, it's
Yeah.
metabolism.
You'll know by how you feel.
You start with that 2.5 milligram dose.
Mhm.
If you want, a starting dose of THC is about 2.5 milligrams, and then you sort of titrate up according to schedule, just like this.
According to how
This
you
would-
feel.
Yeah, according to how you feel.
Feel it.
But very carefully on schedule, so that you can gauge, really gauge what's going on in your body.
British middle board.
So tinctures are a liquid extraction of cannabis. The two most common solutions used are alcohol or oil. The onset and duration is intermediate compared to ingestion or inhalation, right? So it's kind of the middle of the road dose, duration of action.
Between those two?
Inhalation is rapid, and then ingestion takes a delayed onset. It's got to go through the stomach, into the liver, and then get metabolized and go out into the blood. So it takes a while for all that to happen with an edible. And for some people, it may never happen. Some people, whatever happens in the liver during that digestive process, it doesn't send out delta. It doesn't send out the euphoric-based cannabinoid from the liver. It just gets it can be metabolized too quickly. Anyway, that's just something about it. Because everybody wants to know why they can't, edibles do nothing for them.
Yeah, that's interesting, because for some people, edibles put them in the ER.
Yeah. And again, we're talking about this sort of biphasic or bi-directional curve of cannabis dosing. So we have like a sweet dose, and then we go up, and we think we need more, and then we get to this tip of the bell curve, and then on the other side of that are the side effects that we don't want.
Right. And don't be afraid, a lot of people are afraid of
Right.
THC, and so I tell people, you ever had 3 martinis, it's kind of the same feeling, but everybody doses different. This is the good news about herbal medicine is there's no bad side effects like pharmaceuticals. The bad news about herbal medicine is you have to play around with ratios and dose, just what Mo's been saying. So you can reduce your THC. We go low, go slow is our mantra about THC. Go low, go slow.
First thing you taught me.
Yeah, that's right. And so that way you can control the effect that you want to have. But the dosing and the ratios are not based on some silly piece of paper you get from one window, go to another window. It's based on how you feel. So you have control. Sorry, Mo.
And it's all under a genetic sort of predisposition. So yours is not similar to mine, mine is not similar to hers. None of our endocannabinoid system, cannabinoid controlled system is under genetic control.
Yeah.
Everybody is different. So the onset, okay, so we're talking about a kind of a quick onset here, right? Because look where it's going. If you hold the liquid under your tongue, we got lots of little, what are they, vessels or arteries? Vessels that are bringing the blood to the arterial blood system. Like, see how it's, so you hold that tincture in your gums, you're getting it right into the bloodstream, and then it's going straight to the heart, and from the heart out to like systemic circulation. So this too is a pretty quick onset of action. It does bypass the liver when you hold it under your tongue long enough. It's longer than inhalation and shorter than edibles. In terms of onset of action. Tinctures, if absorbed in the bloodstream, like I said, avoid first pass metabolism. But some obviously gets into your stomach, so you will be possibly having some effects of your tincture beyond just what gets absorbed in the arterial blood. So they start working about like 15 to 30 minutes. Brushing your teeth first can increase the blood flow in the mouth and speed the onset of action. So anytime you can make cannabis work a little bit better, you get to use a little bit less, right?
Nice.
Using tinctures has advantages and works well for most patients. They're convenient, minimal odor, and pretty easy to dose.
It tastes awful.
Yeah, I
Gotta be
guess,
honest
Yeah,
here.
it depends.
Oh, okay.
I'm one of those people who kind of love the taste and smell of cannabis. Yeah.
Oh my gosh.
Yeah, so when I walked in the store, I'm like, I'm home. I just,
Wow.
I actually kind of like the smell, like more so than sometimes the effect.
If Mo doesn't mind, at the end of the presentation, I'll give you all a treat, a little dosage of the best CBD tincture in the country, in my opinion.
Oh my God, thank you.
Thank you, yes.
We'll make that.
That, we'll talk later.
Yeah, right.
Someone off the grid, put it that way.
Alcohol tinctures can irritate the mouth and may be appropriate for people who have a history of alcohol abuse. When using an alcohol-based tincture, add liquid to small amounts of warm or hot water, which will evaporate some of that alcohol. So, that can prevent the irritation. Now here's, I think answers your question about smoking. Inhalation is quick. Once inhaled, cannabinoids and terpenes drop quickly into the bloodstream. So you take a puff and there they are, right in the bloodstream, in the alveoli of the lungs. Okay, so the blood is coming through to drop off CO2 and pick up O2, but it also picks up our terpenoids and our cannabinoids and quickly brings them into systemic circulation. This is why inhalation is good for breakthrough pain, migraines, nausea, things that come on quick and you have no idea. Like, it's amazing how quickly, we can relieve some. But we all have to be safe. Okay, here's another microdosing THC. For some, THC medicinal properties can be achieved via small doses of THC that are non-mind altering. So here's two products that have about 2.5 milligrams already in them. It's going to be consistent. This is a company that's doing amazing out in the world. Can. It's a wonderful drink. Carbonated adult beverage that you can bring to parties and if you're a non-drinker and just, sip on it socially, gives you 2.5 milligrams of THC.
What's it called?
Can.
Huh.
And then the petromints I was talking about. Both of them provide easy 2.5 milligram dosing. Juicing cannabis or drinking cannabis tea are good ways to add a microdose of pain relief. It's cheap and effective. Raw cannabis helps by blocking pain-causing enzymes. So, I give a little bit of science to let y'all know, like, it's doing something. It's not just because we're high or this or that. Like, cannabis is doing, and the transactions and the biological interactions that it's carrying out, it's well over like 600, or I mean,
Depending on what you read, we've got between 400 and 600 cannabinoids in those are just chemical compounds from the cannabis plant, in that plant. And we're in the infant stages of discovering what they all do. There's a lot of them, and especially with the entourage effect, as Mo explained, how they work together. So it's quite an amazing plant.
So both of the raw acidic forms of cannabinoids that when you get, like when you drop a little nug into tea in the morning, or you make a pesto, freeze it, and throw it in a smoothie, you're getting strong anti-inflammatories. When compared to a placebo, 2 NSAIDs, and other cannabinoids, raw cannabis wins as the best anti-inflammatory. Both CBDA and THCA are non-intoxicated, and both are very effective at low dosing. So the entourage and why we need it, many believe using whole plant cannabis provides superior effects. This is called the entourage effect. Using the whole plant provides the body with different and various other phytocannabinoids at a ton of different receptors in the body throughout our entire body. So it's just got a lot of amazing chemicals in it that our body knows how to use, and it's actually so supportive, for us to stay mentally, physically balanced. If a single product type or single cannabinoid-based product doesn't provide results, then you can layer the different cannabinoids to achieve a greater effect. When adding cannabinoid, I keep saying that. I usually don't do that about talking to your doctor. All right, so here's a product I've been trialing recently. It's 20 milligrams CBG, 10 milligrams THC. Remember what CBG is, like neuroprotective, and it also helps with attention. Here's just a CBG tincture you can get online because it can cross state lines. CBD and THC can cross state lines. Our non-intoxicating cannabinoids can cross state lines. But this Kana 20 milligrams CBG, 10 milligrams THC, that's a hefty dose, as we were talking about, 10 milligrams THC. CBG doesn't really, it tempers the THC a little bit, but not as much as CBD is supposed to temper THC. It turns down a little bit of the volume on THC. But you're still going to feel like giddy and, whatever you feel with THC. But anyway, that's a good product. And, the thing about these gummies is they can be cut in half. And we saw this slide, THC, and they can be cut in quarters too. So here's THC, doing all the things that THC does that most people don't know, that, this molecule is very busy and does a lot of things for us. CBC is one of those sort of kind of early research cannabinoids that is proving to be very good antibacterial. So, a lot of these cannabinoids can be used for wound care.
Does it say antifungal?
And antifungal, yeah.
Because
That's what these, that's why we have to get the whole flower in us, because then we could potentially be getting some CBC. If you read the COA, there's a possibility that you could be getting some CBC. So that's the argument for whole flower cannabis. You're going to get a lot of different and beneficial results when you use as much cannabinoids as you can. Yeah, and so some of the things people say CBD does, it's an antioxidant for sure. The federal government has a patent on CBD as an antioxidant. So relieves spasms like THC. This says increases the appetite. That's not true. I mean, it's pretty well known that CBD decreases the appetite. So you have to be careful if you have cancer and you're trying to gain weight and stuff like that, because and you have no appetite. You have to be careful with your CBD dosing. It does reduce nausea, but CBDA is a better anti-nausea. Probably THC is a better anti-nausea. Reduces anxiety for sure. It works at the same receptors as lorazepam or Valium. So that's one of the sort of secrets of CBD is it's actually working at a pretty useful pharmaceutical receptor. So Bonnie's rule it in or rule it out method, if you're going to be adding cannabinoid products, start with a low dose of one product, pay attention to whether that dose has achieved the desired effect, and then after 3 days, it does seem like both Dr. Goldstein and Dr. Sulak say, wait 3 days before you change your dose either up or down. And then when you achieve your dosing of efficacy, keep that cannabinoid in your regimen. So that's kind of what I did when I started adding CBG. It's like you pay attention. Is this doing anything? Is this helping any of my symptoms? Is it making any of my symptoms worse? And go slowly and keep a journal and really sort of pay attention to like what you're adding and hopefully the next time you go back to the dispensary, it's still there because that, can sometimes be a problem. So terpenes are phytoconstituents. They're biologically significant chemical compounds. They occur naturally in all plants. Terpenes are easy to get from other natural food sources too. There's like 20,000 of them. 20,000 terpenes. It's pretty early to cannabis terpene research, but beta-caryophyllene is a well-known anti-inflammatory that's been used in Ayurvedic medicine for thousands of years. When you just chew on peppercorns, you're getting quite a few, kind of a big punch of an anti-inflammatory, and that works as a cannabinoid receptors, the CB2 cannabinoid receptors. Yeah. So flavonoids too. Cannabis has flavonoids, and these are biologically active anti-cancer, antioxidant plant constituents that are responsible for plant color. So that's why you're going to get those pretty purples of cannabis.
Yeah.
It's got that one's got more flavonoids or a different type of flavonoid, anthocyanins. So women in pain, women are the fastest rising demographic of medical cannabis users. There are many conditions that affect mostly women: fibromyalgia, lupus, multiple sclerosis, headaches, migraines, anxiety, and depression. To name a few. A lot of patients with these ailments just don't get relief with pharmaceuticals, but these conditions do respond very well to cannabis treatment and cannabis protocols. And so here we're going to end kind of where we were at the beginning. That pain, I don't know if I'm by too quick, I don't even remember saying that point, but pain overrides almost all of our other neurological functions. So it's hard to think when we're in pain, it's easy to be stressed, it's quick to temper. Pain signals get more intense though, and more frequent when we're in a bad mood and we're hyper-focused on it. So then we get into this vicious cycle. We're in a bad mood because we're in pain because we're in a bad mood. Same with sleep and pain. We're in pain and we can't sleep, and the less we sleep, the more we get, pain. So sleep is one of the most important factors for reducing pain. That's a good place to start. Start with getting a good night's sleep. So anyway, cannabis loosens the grip on our perception of pain. Many feel cannabis changes the nature of their pain. In other words, cannabis changes their perception. By making pain more bearable and less distracting, cannabis shifts how people behave in response to their pain. People who use cannabis for pain report they are less anxious, less distracted by their pain, and therefore find it more easily managed. So the point being is that, in the sort of beef of this lecture, I kind of taught you or tried to teach you how cannabis actually works for pain, like at certain scientific, biologically active receptors that cannabis has an affinity for. And there are many of these throughout our entire body. And now I'm just trying to tell you that even if the only thing it does is soothe our pain and ease our anxiety, well then, that in and of itself is good enough. But it's working on two fronts here. Many say cannabis helps them better handle negative feelings and setbacks, and making pain less emotionally burdensome can also be helpful in relieving pain. Chronic pain patients who use medical cannabis feel they can manage their symptoms and carry out their daily lives better. Oh, ta-da!
Right.
Yeah.